Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo. We have an informative and exciting show for you this evening. We're talking about innovation and ingenuity at St. Luke's. We'll be joined by a talented panel of medical experts and discuss the many ways St. Luke's has stepped up to the plate in the face of COVID-19. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at innovation and ingenuity during the COVID-19 crisis with St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. James Balshi. Dr. Balshi is the Chief Medical Information Officer for the network. He's a fellow of the American College of Surgeons and has extensive experience in renal, vascular, carotid artery, and lower extremity bypass surgeries, and has a special interest in complex aortic surgery and aortic stent graft repair. Dr. Balshi also has advanced training in future technologies that reduce the invasiveness of vascular disease treatments, which will significantly benefit his patients.
I'm Dr. Jim Balshi. I'm the Chief Medical Information Officer for the St. Luke's University Health Network. I was the son of a physician and also the brother of a physician and another physician, and it's part of our family, and it's been a part of our family as long as I can remember. As a surgeon, I had a 30-plus year career in vascular surgery at St. Luke's. My involvement in the technology side of this really was in parallel. And many years ago, as computers started to roll into the hospitals and become a bigger role, I served in an advisory committee to some of the technology department, helping them to adapt the previous technologies to our healthcare system, and more recently, the Epic electronic medical record. I like to see the fruit of creative thinking, and I am always fascinated by new things and the creative thinking that leads to those new technologies. That's the real joy I find in working in the information technology part of healthcare.
Thank you so much for being here, Dr. Balshi.
My pleasure.
Can you tell me a little bit about where your profession as a vascular surgeon and a medical director intersects with being a Chief Medical Information Officer?
Well, I had a long career as a vascular surgeon at St. Luke's when the opportunity to move into the IT department arose as we were bringing the electronic medical record, Epic, to our 300 ambulatory sites. And this was a great challenge and a great time for me to take advantage of my other interest in technology and really build a program that supported the electronic medical record and helped to integrate medical care with the technology in the IT department. On top of that, we had, this virus thing come up, and it clearly threw us into a whirlwind of change. And our ability to adapt quickly and employ a lot of new technology in response to that crisis has really been a exciting adventure.
Well, it's been very incredible what you've been working on. We can't wait to hear more about it. Joining our panel next is Dr. Peter Ender. Dr. Ender is the Section Chief of Infectious Diseases at St. Luke's University Health Network. Dr. Ender aims to make an impact on people's lives by getting to the bottom of his patients' illnesses and providing the best possible care. In addition to taking care of patients, Dr. Ender is passionate about strengthening the future of medicine by teaching medical students and residents and advocating for the concept of collaborative care.
I've had an interest and passion in medicine for a long time. Initially, I had an interest in sciences in school, but I also had family members who were involved in healthcare, such as nursing. And over time, it seemed like a natural gravitation that I enjoyed the scientific aspects of medicine, but also the direct patient contact and interaction. Infectious diseases is incredibly interesting. When I went into medical school and saw how interesting the cases were in infectious diseases and how you could actually relatively quickly with some infections cure people, it was very interesting in that aspect and gave me a sense of reward to be able to cure people. I love what I do because it fascinates me intellectually, but I also love what I do because I feel I can make a difference in patients' lives.
Dr. Ender, thank you so much for joining us.
Thank you, Ashley. I appreciate it.
Tell me a little bit about how you got interested in infectious disease and the complexity that comes with that field.
Yeah, infectious diseases. I was an environmental science major in college, and I always had an interest in how different living creatures kind of interact together in a large biome. So, that kind of started things off. And then when I went to med school and into internal medicine residency, I just realized that the infectious disease cases were so fascinating. And in addition, I realized that a lot of these times we can cure these problems, whereas in some areas in medicine, it's much more of a challenge to do these things. In infectious diseases, it was very rewarding to be able to cure someone relatively quickly.
You see so many complex cases. This must be a very fascinating time to be an infectious disease physician.
Nowhere have I seen such complexity as have seen with COVID-19. When I take care of a lot of very complex patients, including patients who have HIV and AIDS and other complex infections, but this one, because it was so new, so novel, and did things that we had just never seen before, we were in a lot of ways learning as we went along. Very complex.
Thanks, Dr. Ender. Let's meet our final panelist, Dr. Eric Tesoriero. After Dr. Tesoriero completed his fellowship in critical care medicine at Beth Israel Deaconess Medical Center, he joined Anesthesia Specialists of Bethlehem and practices as a critical care anesthesiologist. Dr. Tesoriero is dedicated to providing high-quality, evidence-based care both in the OR as an anesthesiologist and as an ICU physician. He also serves as the medical director of the ICU at the St. Luke's Monroe campus. Outside of work, Dr. Tesoriero enjoys spending time cooking and being at home with his wife, son, and dog.
My name is Dr. Eric Tesoriero. I'm a critical care anesthesiologist, and I'm the medical director of the ICU at the St. Luke's Monroe campus. I first became interested in medicine probably around the middle school age, and I just thought that science was the most interesting subject in class, and the ability to really understand a complex machine like the body and help others. One of the most important reasons to stay up to date with current technology is being able to practice the most evidence-based medicine and being able to practice at the top of the field in the most modern way possible. St. Luke's has a really awesome team of physicians, nurses, and allied staff. This is a great place to work overall, and everybody here is happy and loves to do their job. It makes me feel really professionally satisfied to be able to help my patients and to take them through some of the worst days of their life and try and help them navigate those waters.
Dr. Tesoriero, thank you so much for being with us this evening.
Thank you for having me, Ashley.
Explain to us a little bit more about your work as an anesthesiologist with critical care patients and how those two fields really work together and hand in hand for the good of our community.
So anesthesiology is one of those fields that can participate in critical care medicine, and it has a unique perspective on it, in my opinion, where we see patients who have surgical needs, but also patients who have medical needs, and really navigate the combination of those fields. As a community, we do a great job of taking care of folks in that intersection and providing them high quality care and helping to integrate and streamline that care.
Thank you all for giving us some background information on your expertise. Next, we're going to learn a little bit more about some of the ways the network has been using technology and innovation to combat the coronavirus. Stay tuned. We'll be back after a short break. You're watching St. Luke's Health Now. Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals, Dr. Balshi, Dr. Ender, and Dr. Tesoriero. We've started to discuss the basics of each of your disciplines. Now let's discuss how you and the team of medical professionals at St. Luke's has been innovative in fighting COVID-19. Dr. Balshi, how has St. Luke's been creative with their communication and the technology use during this time, especially at the beginning of COVID-19 when we really didn't know what we were dealing with?
We were really fortunate to have embarked on the journey of bringing Microsoft 365 to the entire network about a year prior to COVID-19. And we had embraced this in the information technology department. That gave us a tremendous groundwork that when we suddenly had to provide virtual care to patients where we had almost no experience, we were able to train 1,900 providers and staff in a 3-day period on how to do virtual care visits.
Pretty amazing to see how you could pull all those people and those technologies together so quickly and effectively. But Dr. Ender, beyond that, how did you see the communication happening behind the scenes with the medical team responding to those early patients and those early needs using the technology Dr. Balshi just referenced?
Well, it was absolutely critical. I mean, it's particularly on the outpatient side where, we weren't really seeing patients due to safety reasons, in the office. And we were able to quickly, because of the ease of use and the history that St. Luke's has over the last few years with just being very flexible with their technology and implementing new systems. As far as losing patients to follow-up during the COVID crisis, our numbers are actually a little bit better since we went to telecommunication because we're able to reach out with those patients and communicate with them without missing appointments. And our numbers as far as their care, as far as getting their virus undetectable, is as good, if not better. So that's just one example that's not directly related to COVID, but certainly the COVID led to us using technology that showed that we can continue to take care of other problems.
And we're seeing that across so many areas of life right now, right? We're learning that we can do something because of this that maybe can stay. But Dr. Tesoriero, critical care is usually a hands-on process. How has this changed for you during COVID-19?
We had to look in just how we were delivering that care and how we could be more efficient about it. One of the biggest concerns throughout the beginning of the pandemic was how effectively we were using personal protective equipment and would we be using it too quickly. So we looked at how many times we entered the room and how we could effectively use that time more efficiently, whether it be cross-training staff to address alarms, whether it be methods to extend the length of our infusion pumps and place them outside the room, and means to collaborate with other physicians, whether it be providing telemedicine consults from consultants who aren't there, and maybe working remotely.
And a lot of these skills are not necessarily things that physicians learn or medical professionals learn during their training. So Dr. Balshi, how quickly was the team at St. Luke's able to provide that training, even just for the staff, to get them up to speed on the technologies you're talking about?
We all did this together. We all explored technical communication in new ways. But one of the things that I found was really striking was our ability to educate in this platform and to use technology to expand our educational avenues and tool belt. And it really has been very effective. We've been able to socially distance by keeping our training rooms down to a minimum number of students, while we still could reach a larger audience by using this technology.
You mentioned keeping patients safe, and Dr. Tesoriero, how did the team at St. Luke's take action on early initiatives to help sick patients?
This has been a long journey, certainly in reflection of how COVID has evolved. There was great communication internally with making sure that the hospital was safe and making sure the employees were safe in providing care to patients who were affected by COVID. One of the challenges as a medical community we saw was that the patients didn't perceive hospitals in the beginning of COVID as a safe place to come. And we saw that with some large studies that showed that unfortunately patients were not presenting for care after having their myocardial infarctions, heart attacks, or their cerebral vascular event strokes. We've done a great job of making sure that our community knows that we're taking universal precautions and are fundamentally concerned about the safety of our patients. And we want to make sure that the long-term medical needs are not neglected.
Great information from all of our panelists, but we're not done yet. Coming up after the break, we're going to take a look at how the community partnered with St. Luke's to help during the COVID-19 crisis. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an intriguing show for you tonight. We're talking about the innovation and ingenuity St. Luke's has demonstrated during the COVID-19 pandemic. In case you're just tuning in, I'm joined by three St. Luke's medical professionals, Dr. Balshi, Dr. Ender, and Dr. Tesserero. Thank you all for being here. In the first part of the program, we talked about some background information from each of your disciplines, and then we talked about some initiatives the network has put in place to combat COVID-19. Now let's dive into some specific ways St. Luke's has been innovative during this time. Dr. Tesserero, I want to ask you about PPE equipment. There was such a concern in the beginning that there wasn't enough, and how were we going to get it in people's hands? And there was some really cool innovation, one of the things being a thing called a bug zapper. Can you tell us a little bit more about that?
Absolutely. So early on with COVID, there was great concern about the availability of personal protective equipment, and specifically the respiratory equipment that we'd use to protect providers. There was a question as to how to make that equipment more readily available and safe for its additional use. And through some colleagues, I actually collaborated with a professor at Lehigh University, Dr. Nelson Tansu, and we basically were able to get the concept of UV light can sterilize and reprocess the equipment safely. And we were able to bring that from a small scale idea actually to a large operating technology so that we can sterilize a couple hundred masks an hour and be able to have that equipment available for our inpatient areas and other ancillary departments and even some of our EMS associations.
It was pretty incredible to see the way the community stepped up, from people making masks to donations. How important was that to you in those early days of trying to provide critical care medicine in such an uncertain time?
It was just humbling to see the outpouring of support from the community and everybody doing what they can to support the team as a whole, whether it was masks from the community or different distilleries switching their production to making hand sanitizer.
As people started to recover from COVID-19, Dr. Ender, we started to hear more about this convalescent plasma and those donations. Can you tell us what that is, and is it proving to be somewhat effective?
So yeah, convalescent plasma is basically in somebody who has recovered from COVID-19, they can donate their blood and a plasma is obtained from that blood. And in that plasma are infection-fighting proteins called antibodies that have helped them recover and can be transfused into an ill person with COVID-19 to help them recover more quickly. And there's at least an initial signal that there may be better outcomes with using convalescent plasma. I think we were novel at St. Luke's with coming up with a treatment protocol that we integrated an antiviral approach, including convalescent plasma, antiviral medicines like remdesivir, and the use of corticosteroids. And this was even before some of the other institutions were even thinking this type of approach would be beneficial. So we collaborated with pulmonary critical care, with the pharmacy, put all these pieces together, met every single week, looked at all of our data on a regular basis, and made adjustments accordingly. And doing that, we really saved a lot of lives.
It's amazing to think about that level of collaboration and what's going on behind the scenes. And Dr. Balshi, you mentioned that the partnership with Microsoft Teams for St. Luke's has really been a huge innovation. Tell us a little bit more about that and how important it's been to where St. Luke's has been able to go during this crisis.
Well, we can talk about the preservation of personal protective equipment by using Microsoft Teams and a deployment of about 400 iPads across our network to allow virtual rounding in rooms where patients were known to have or suspected of having COVID-19. And that allowed physicians and nurses to interact with the patient without actually having to enter the room. In addition to that, it gave us a platform to allow the patient to communicate with their family. And as you know, most of the hospitals across the eastern portion of the United States instituted a no visitor policy. We had that policy early on, and it really was challenging for families to deal with patients who were both in the ICU and in regular hospital rooms who couldn't have visitors. But the technology allowed us to set up conference calls just like this with family members and physicians and patients while they were in the hospital.
So important to be able to connect with people while they're sick. It's just one of the most difficult things I think we've seen families go through, is that separation. And Dr. Deserero, you are there on the front lines often with these patients. Do you see this continuing into the future? I mean, eventually we'll hopefully have a vaccine and we'll see some, back to normal, whatever that is. But do you see some of this technology being helpful to you as a physician in your field?
I think that the technology that we've developed here is going to take us much further along. The ability to communicate and collaborate in the way we have is of critical importance. And critical illness is one of those isolating features, unfortunately. And any ability we have to engage with the family in a more productive fashion and be able to have that presence there for any more time is going to be really key to continue going forward.
Dr. Ender, you mentioned some of the therapies that are showing some promise. What are still the basics that you want people to know about their safety and the precautions they need to take around even getting this illness in the first place?
This has been well documented, and now there's good studies that show that, social distancing, keeping space between individuals, the use of face masks, not so much for you, but to protect people that you may expose to the virus unnecessarily. Because we know now that this virus perhaps can be transmitted even when people haven't appreciated that they have symptoms and they're not ill. So those are two really important ones that show data behind them that we need to be think of others. It's just good human decency not to want to spread this virus, and there are good ways to not spread. Good hand washing, of course, goes a long way, but I think the masking, if we could all just agree that use of a mask when we can't be distant is very effective, I think it could go a long way.
Thank you all so much. It's just been incredible to see the way the team at St. Luke's has stepped up during this time. Up next, we're going to take questions from our viewers. Stick with us. You're watching St. Luke's Health Now. Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about the innovation and ingenuity at St. Luke's. Now we'll read some questions from our viewers. Dr. Balshi, we have one viewer that writes in, how effective is telemedicine?
It really is a tremendous imposition to get patients into the office. And we took a sort of a matter-of-fact approach to it. Well, you had to come to my office, but in fact, you don't. Many, many times you don't. And it's not just in the primary care space. It's really in the specialty space where we do so much discussion with the patients. Primary care, yes, you're covering all those bases, but in specialties, you talk about an operation, you talk about risks, you talk about recovery and those things. You can do that in a televisit just as effectively as you can in person. And that's where I think you're going to see a tremendous movement if we can get payers to pay for it.
Good to know. All right, Dr. Ender, I think this is one for you. What should I do if I think I'm experiencing only one or two symptoms of the virus?
Well, I think the best point of contact is your primary care physician. Our primary care physicians have been well versed now in asking the appropriate questions, going over on the phone and discussing if you need testing based upon even just a few symptoms. Some of it's going to depend upon risk in the community. Some it's going to depend upon whether the person's been directly exposed, but some of it is based upon symptomatology.
All right, Dr. Balshi, this one is for you. When can we expect there to be a vaccine for the virus? I know you have that crystal ball, so can you tell us the answer to that question?
Well, I think, as you know, trials have started already on some of the manufacturers' protocols. And I think that we will probably have many patients signing up for those trials. But the actual general release of the vaccine will require us to study how the trials produce the vaccine and study the effectiveness. We know the criteria that we need to meet. And so this will be a data-driven process. And I think even though the trials have started, we have to probably go 3 or 4 months of trials before we can start to analyze those and then move to production. So 6 months is going to be really fast. And I think we're probably looking at more like 9 months from now.
So knowing that we're looking at a longer time frame, Dr. Ender, someone writes in, how long can we expect to have to wear masks?
Boy, that is a tough one. We have all been humbled by this virus. We have all learned so much, and we're continuing to learn so much. And I think best case scenario is that if there is a vaccine available by early in the year, January, February or so, I cannot imagine a scenario where we don't have to have some element of social distancing until at least this summer coming up. So probably another year or so.
Good for people to settle in on the reality and adjust to it as they need to. Dr. Tesoriero, I want to ask you our last question here is it safe to go to the doctor? We all need to go to the doctor for certain things. Should we be going?
It's absolutely safe to go to the doctor. We're practicing social distancing and masking for you to be safe for you. The most important thing is taking care of your health, your family's health, and your children's health.
Until the last month or so, there was a concern that kids weren't going in to get their vaccinations. The more recent data shows they are starting to come back. But I think it is critical to know that kids need to get their, not just adults, but kids need to get their routine care, including vaccinations for other types of infections.
Perfect. Thank you all so much for being here, for your expertise, and for all that you and your teams at St. Luke's are doing for the health and wellness of all of us in the community. We thank you so much. For more information on anything from today's show, visit their website at sluhn.org or call InfoLink at 1-866-St. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember it's important to focus on your health now.